Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
So we've spoken about the bad things that cocaine can do to you. Crack. Usually they smoke it mixed with marijuana. Marijuana is a downer. The crack is a stimulant. So they kind of mix both of them together. Nevertheless, when we took the blood pressure for this patient, it was high. When we checked the heart rate for this patient, it was high. We were supposed to be ECG. We were supposed to do ECG to find out because the cocaine causes widening of the QRS, meaning it can put the heart down. It can cause heart failure. And that you see on ECG of that patient. I said, those are very low socioeconomic class patients. They don't have anything. So we rely basically on our clinical experience. We have to do a couple of tests. Those are the very necessary tests. And then we decide what are we going to do with the patient, how to save the life of the patient. So this patient will die of what? This patient, if he will die of cardiovascular complication. Cardiovascular complication, we said the heart. The heart, we have widening of the QRS, which meaning the heart is at risk for heart failure. The heart also, because of the tying and the spasm, the narrowing of the vessel leading to the heart, we can have myocardial infarction. We can have ischemia to the heart. So the measures that has to be taken is first, save that patient life, lower the pressure by at least 25% of the value that he came in with. So if he came in with diastolic of 150, we have to bring him to about 100. Diastolic of 100. We care most about diastolic pressure because diastolic pressure is the reflection of the arterial pressure. And we said the cocaine is the one that causes vasospasm, especially arterial spasm, meaning narrowing of the arteries. Then the next thing we have to do is what? We have to save this patient life from cardiac infarction, myocardial infarction. So we're gonna give something called nitroglycerin sublingual. This is the doctor will do that to make sure those vessels relax. We'll have to give another IV medication to quickly control the pressure, and but not to drop the pressure more than 25%. We reach about 100, 105 diastolic, and that is the target. Now we save the patient as far as the cardiac. Now, but this is not the only thing cocaine does. Cocaine is a multi-system damage. But the most important 3 systems are number 1, the heart, number 2, the central nervous system. So the central nervous system, what cocaine does is make you happy, make you paranoid. Paranoid, but the patient will accept the paranoia in exchange for the euphoria, the grandiosity. He is feeling big because he is nothing in real life. So he goes to cocaine to make himself more important. Yeah, obviously it's for a specific hours or so, and then you suffer the intoxication, but the sense of grandiosity is so nice to them, to those who use cocaine. Now also, it has another thing that the patients or those addicted patients go and use is the sense of control. When you take cocaine, you feel control. And also, you feel a little bit focus. That is why some of the surgeons in United States, but they take control dose, they take cocaine before they go to do the surgeries. Is it okay? No, it's not okay. because one dose, small dose today, will turn into addiction tomorrow. So, but I'm just telling you what is going on, because doctors also use cocaine, especially surgeons, to keep them focused. Is a bad thing? It is a bad thing. Is this doctor should be dismissed? Should be dismissed. Because you cannot be using drugs while you a medical doctor. But do you use controlled dose? But you can never say controlled dose, because, as I said, it starts small and it gets big. So there is nobody immune. So I told you, so the highest socioeconomic class doctors use it. The lower socioeconomic class, that is this patient, as this patient came in, they also use it. So now we have to think about something together. Why did those guys, the doctor in that high economic class, the patient that is a farmer from the lower socioeconomic class, why they go and use cocaine or any substance for that matter, but let's focus on cocaine. The fact of the matter is there are triggers. There are triggers that want to make you go and do that. So there is something in your life that is stressing you out, that you want to escape even for a small amount of time, so you lose your mind to get away from this problem facing you. So this is what we call the triggers. As a physician, as a treating physician, you have to find out what is the triggers. So we do what is called hypnotic therapy, hypnotic psychotherapy, to find out deep in the brain what is the problem. Why are you going to alcohol, cocaine, heroin, whatever it is, to get away from what exactly? And that is the cause of the issue, the triggers. We must find out what triggered him to go and use this substance. So this is very important for us to do. Now, those patients, unfortunately, all share the same story. They used to have family, now they don't. The family is there, but they cannot do anything for the family, because all they think about is what? Is the drug. If we talk about cocaine, all they think about is cocaine. All they talk about is cocaine. All their life is centered around cocaine. There is nothing else he sees except cocaine. If his money is finished, he will steal from his own mother, his own father, his own family, because all he needs is his dose. So there is nothing going on in his life. He is not functioning in life anymore. He is the living dead. The only concern he has is the substance that he needs to take in, whether cocaine, whether a downer or a stimulator. Okay? So their life is screwed up. They have no life. And the sad thing is, they lost their life to drugs, but also the family around them suffers. And you can imagine the suffering for this patient that came in. Who brought him in? His mother, his father, and a couple of brothers. Who are these? Those are the family. So who's suffering? The family. Who's enjoying the drug? The patient. Now, does the story stop here? No. It's a lot more to it. Those patients will not realize what they are doing, and they will not really stop only in one condition, which is they'll have to hit bottom. When I say they have to hit bottom, meaning they lose everything. They lose everything. Family, house, money, job, everything. I got this patient, and he said that he's so much on that smoke that sometimes he doesn't have a house, because that's another patient. He smokes one in the back of another, one in the back of another, that he doesn't even recover. He doesn't recover. He's always back to back, till he knocks himself out, and he sleeps wherever he is. That could be the bushes, that could be the street, that could be here, that could be there. So he knocks himself out or herself out, to the point that they don't even go home. They sleep right there in the street. They sleep right there in the street. So if you want to treat those patients, we have to talk about self-determination, meaning that patient has to be determined to cure themselves. And what does that mean? It means that if I take a patient for drug addiction and I admit him for a week, 2, 3, 4, till I detox everything out of his body, does that mean he's cured and that's it? He's a good member of the society and he will not go back to it? No. 50% of the cases relapse. After we treat addiction, the patient goes out there and he relapses. He sees his old friends, he take a joint, 2, 3, he's back into business again. So those patients to be treated, really, what I have seen, those patients to be treated is when they realize they are at the bottom. They don't even have a home to sleep. Like this patient telling me, I don't even have a home. The home is there, but he cannot make it to the house because he's always smoking back to back, and when he gets knocked out, he sleeps wherever he is. You see? So that is the issue. When they realize they are at the bottom and there is nothing else lower than the bottom, they will wake up. Some of them will wake up and they will come themselves and seek treatment. Doc, I'm tired of it. I want to get rid of it. Can you help? Yes. Because they already have seen what it does to them. They already have seen what it does to them. We have not finished talking about the complication of somebody intoxicated with cocaine. We said the brain, the good thing, or what they think is the good thing about cocaine is we have the euphoria, we have the grandiosity feeling, but sometimes it comes to the point of psychosis. So we have to treat them as a mad person. Dopamine is too high in those patients. We have somehow to lower dopamine, the same way we do with psychotic patients. Okay? Also, we have to remember that in those patients, cocaine causes a lot of release of something called norepinephrine, noradrenaline. So norepinephrine is high. So we have a constricted vessels. We have norepinephrine that is very high. Both of them lead to very high blood pressure, and that is the problem. The very high blood pressure that can blow a vessel and cause a stroke. Nevertheless, talking about stroke, cocaine in itself is also an enhancer to form clots, thrombosis, thrombus, a clot. So that's an invitation for a stroke. So this patient has to be dealt with very seriously, and you have to know what you're doing. So first step, we have to lower the blood pressure. Second step, we have to make sure the heart is good. Third thing, we have to give an anticoagulant or something to prevent any stroke from happening or any thrombosis from taking place. Now, it's not only now don't forget, this patient's having seizures. What you seen in the video before, that was a seizure. That was an onset of a seizure right there. And the patient, we're going to see the video later on, the patient after recovery, he does not remember that we showed him the video. Do you remember this? He does not remember anything of it. So that was a seizure induced by cocaine. We have to stabilize his brain by giving some medication as well, so it doesn't continue.